are live.
We are live. Here's Summer Forum.
That's right.
It's fun. We're having a good time. We already had one recording, very good, from a rival, the Ohio State. But now we're with Big Blue, the Big Blue of University of Michigan. Our great friend, Dr. Nick Prush, respiratory extraordinaire in Michigan. Welcome to the show. We're super excited.
Yeah,
hey, golf clap.
Absolutely, golf.
Yes, golf clap.
This
golf clap.
This is so cool. I mean, coming to conferences like this, you meet so many different people, and I don't think that I would have crossed paths with you unless I came to a conference. So, people out there, get to your conferences.
Yes,
it is important.
Please.
Yeah.
JJ and I talk about this all the time, and actually, you and I became fellows together last year.
We sure did.
We have a bond. We have a bond.
We sure did.
Forever.
Nick and Matt together. But when we come to conferences, my pin's over there. I remember my pin. When we come to conferences, it's great to get the education, but spending time with colleagues is really what matters, because I learn about stuff that I didn't know. Last night JJ and I are sitting at dinner, and you came up.
Yeah.
You did this 2, 1, 3, 4, 1, 2, 1. I don't know.
That's the Penn State from Mountain.
Penn State. The Penn State.
Yeah, it's coming out. Okay. Sorry, I apologize. But you have like a special program that JJ was talking about, and I'm like, I need to hear that from Nick directly. So tell us about this program that you have.
Yeah, thank you. First of all, thank you guys for the opportunity, and the networking piece of these conferences is what makes it so unique.
Absolutely.
Right.
And, as a respiratory therapist, you don't realize that as a practicing therapist, but we as leaders, educators, we have to do our job of voicing that to them. And I'll never miss one.
Yeah.
As long as I'm able to come to these, I'll never miss one, especially a summer forum. But to speak on the 1+2+1, I guess we call it the 1-2-1 program, essentially. It came about through a colleague of mine, Shane Spalding. He was my director of clinical education. We've worked together for a very long time. Mm-hmm. We've had these conversations about how do we help save students time and money.
Okay.
Because that's what, when you start to recruit for a degree advancement program, people say, which one is the fastest? Which one's the cheapest?
That is literally what they say. Yeah, absolutely.
You're part of break room or all of these places. How fast can I get it done?
Right.
Is it going to cost me $10,000, $15,000?
Yeah.
And then they pick and choose, and rightfully so. So our job was to look at how can we start earlier and create this 4-year product without hindering what we have already in the state of Michigan. Okay. And what we have already in the state of Michigan is 10 really robust community college programs.
Yeah.
Right?
Yeah.
So I could say, yes, University of Michigan, we're going to create a 4-year bachelor degree entry to profession program. Right. But then I'm competing with 10 other.
Yeah, and 10 other schools that you respect. Like, they're doing a good job. Like, why would you want to compete with
they're getting co-arc success rate awards. Yeah. And why would I want to compete with them?
Exactly.
How can I help them?
Right.
So we looked at the numbers to see, and the numbers are staggering to see the lack of students sitting in seats in all of these programs.
Mm-hmm.
And co-arc. The numbers this morning in our session to show that we're missing the boat in terms of how many RTs we're producing. And so we decided, how can we help that?
Yeah.
And we're out on the recruitment trail telling people about what a respiratory therapist is.
Right.
We started with the senior level high school student, and we've evolved now to let's get the freshmen so that they have time to decide and think about this. And we've evolved around, if we can get them to have the university experience in that first year.
Because that's important. That's important to have that university experience that first year, because just before, like, because I know this is such a good story, but like also, I remember back as a senior in high school, and I wanted to go to a major university,
Of
but
course.
I also knew that I couldn't afford it. I
Correct.
also knew there were some other challenges for me. So I did go to the community college route, but had I gotten that university experience, I could have, lived in that world for the year, knowing that I was going to move on to something like you're about to talk about.
Yeah, and it's done so far. We've done these things to where we can get the student come first year, they get the university experience. We then give them all the gen eds of the pieces that they need to be a successful respiratory therapist. Because also what was happening in the state of Michigan is this credit crunch at the community college level, right? Get it as close as you can to 60 credits.
Mm-hmm.
And we know that it's nearly impossible. If you want to give them the content, because do you really want to start slashing courses or credits or content if you're getting the COARC Credentialing Success Award
Exactly.
for 10 years running, 12 years running? Why would you want to cut any of those things?
No, and when I think about it, I've been doing this way too long, which JJ will remind me. Like my Egan's was half the size of
Yeah.
what you have today.
Weird.
So what you're shit. But you're still trying to cram in all this new information in 2 years. You got to cut somewhere. You're going to run out of time at some point. So I had that college experience. I went to Mansfield, the Mansfield University, like nobody's ever said that. And I had that college experience, but that first year, it just can't get my gen eds done, right?
Yeah.
Just get it done. But then I knew I had to buckle down. So kids out of high school are going to go to the University of Michigan for a year.
Yep.
Get that. So that's the one.
That's
Then
the
there's-
one. So they come to us.
Okay.
We create that, and we have it literally laid out in a 4-year plan for them.
Okay.
So they will come to the University of Michigan, live on campus, get the dorm life, get the full experience, and do the gen ed courses, the chemistries, do all the labs,
Right.
the anatomy and physiologies, the higher level math. I can talk to that here. We did a study to see, which gen ed proved to be the best gen ed to show success rate for board exam pass rates. And I went in thinking it was the better you did in A&P, the better you're going to pass. But it wasn't A&P. You guys, what class do you think it was?
Well, I think you hinted at it.
Yeah.
Is it math?
It's math. Why do you think?
There's so much math. Like the pharmacology, the formulas, you've seen the shirts, breathing's easy, breathe in, breathe out, but then it has the whole slew of respiratory formulas.
But anecdotally, what does math do to us?
It gets you to start to understand a more complex problem.
Right.
Right.
And it's without telling a student, they can see a problem and create a solution.
You got it.
They critically think their
They
way
critically think their
That's
way
cool.
through it.
through a problem to come up with a solution. And so the data supported that better you were at a higher level math, the more likely you were to be
To graduate.
successful, not only graduate on time, but also to have a successfully pass your TMC and your CSE on first attempt. And so you go into this and you're creating these curriculums and you say, we got to get them high level college algebra.
Right.
You know what? You now have a best friend because my mom is a math teacher, Molly Reinhardt. This is Nick.
Hi, Molly.
There. But she would say the same thing. If you're good at math, you can be good at anything. It does make sense.
Yeah.
It's you do a ton of algebra. I remember when I took my MPS exam. I remember what I did in the parking lot before I went in to take it. I wrote down all the damn equations
Yeah.
to make sure I had it because I knew I was like, if I could get the equations,
Right.
I was going to pass the test.
Right.
Did the same thing with my RT. If I had the equation, I was going to be okay. But it does make sense. That's pretty cool.
Yeah.
So you have one at the University of Michigan having a great college experience. What's the two?
So the two part of it is then as they're doing this first year, they come and I meet with them along the way and I say, here's 10 community colleges that we have in our state of Michigan.
Mm-hmm.
Which one do you want to go to?
Hmm.
Pick one.
You don't care.
I don't care which one. It can be the one that they live next door to. It could be one that they want to go to because it's on the water and they have dorms. I have the ability to pick and choose which one because I've created a pathway at each one of them. And they'll come to me, right? So student, most recently said, well, I'm living on the dorms and campus here. I would like to be on the dorms and campus at the community college. Well, I have one for you. It's sitting on, Lake St. Clair. The dorms are right there. It's a community college. They have a respiratory therapy program. Call up the program director, let them know, hey, she's going to be applying, and we've created these pathways, and so they get in. The goal is that they get in, within that transition period. So that's the purpose of the two. They will then go to that community college and complete the RT program in year 2 and 3. So after 3 years,
You have a pretty well-rounded RT right there.
yeah,
Wow.
And they're sitting for their boards, right?
after year 3.
After year 3, great success rates on all of those.
Wonderful thus far. Of all of the 1-2-1 students that have matriculated through these community college programs, they've been at or near the top of these classes.
Wow.
Yeah.
Because they're coming in prepared with university level gen eds. And the higher level gen eds, the chemistries, the things that are being cut, the microbiologies,
Right.
that are being cut at the community college level because they're saying you have to get it to be 2 years and 60 credits.
Yes, you got it. So, JJ, tell me because you guys are educators and it's been a long time since I educated. Like CoArc has an attrition rate, right? That you have to, and you don't want it, but it's very hard to get around it, right? It sounds like you're getting around it because you're having them be real college students first before they do it. So like your attrition rate's probably nothing because either they're going to go to RT after the first year and be successful, or they're going to go into nursing or a different program or just do something. Wow.
Yeah. And when I first started at Victoria College, I gave Nick a call because I had heard about this 1-2-1 program, and I was like, dude, what are you doing? Because this is just like, because it sounds like you get the well-rounded, you get that life experience of being at that major university, and you come in with a different level of preparation, right? And that's something that we're kind of seeing a struggle with is a level of prep.
College is a big jump from high school. Let's just be honest. I think a lot of college students get a little shock when they first start. They're like, "Oh my God, I actually have to study now. I have to bring a book home.
How do I study?
Freedom.
Yeah.
Freedom. I don't necessarily have to go to that class today. I can miss.
Right.
You're making good decisions. I remember when I was in college, I didn't always make good decisions, but it's true. Like Susan Ferrito, my DCE, my initial mentor in respiratory, she almost failed me out twice because I was just too young and naive. Like I didn't realize the work that went into it, and you're getting that out of the way.
Yeah.
That is brilliant, by the way.
Yeah.
It's brilliant.
Yeah. And I mean, I can speak to those things too, because I was a hothead going into RT school. I had just retired. I was a semi-professional hockey player, and I wanted to do something in the medical field. I had always wanted to go to med school. And when I walked in, Debbie Szymanski at Henry Ford College in Dearborn, Michigan, they took me up to the respiratory lab and said, well, we get to breathe for people that can't breathe. And I was sold the minute I started. They had all the vents running, the MA1s and the birds. And I go, I get to control this.
Yeah. JJ, an MA1 is a ventilator.
It's a ventilator.
Yeah. It's not just an acronym.
No,
it's an actual vent.
It's an actual vent that we use.
Had a little bellows.
Did it have the bellows?
Yes.
Had the bellows.
No SIMV, right?
None.
No.
You had to have like a dial for PEEP.
Yeah.
Yeah. I just want to take it down.
I think I've seen one on
a little memory lane.
the AARC museum. I think I've seen it there.
Uh-huh.
Yeah. Same with the 7200 that you could literally roll through a door and it would open the door for you.
Oh,
Yeah. I did work with the 7200. I did work with 7200. We
Yeah.
did see an MA1, but it wasn't at the school I went to. But
Gotcha.
I mean,
Yeah.
Just,
So
just saying. Just
but I
throwing
mean,
that
I've
out.
been doing this for 30 years,
Yeah.
so you
and
know.
Debbie did like your DC did with me. She pulled me in the office and had a stern talking and said, if you really truly want to do this, you're going to buy the books and you're going to study.
Yeah.
You're not just going to come to class, and I know you can pass and you were doing fine, but
Oh yeah.
you got to really know this stuff. There's somebody's life at the end of it. And that really was the trigger for me that told me that, all right, let's pull up our pants a little bit, tighten our belt, and say, this is what you want to do for the rest of your life.
Yeah.
Maybe it is, maybe it isn't, but here I am.
You're going to take it seriously.
And I took it seriously.
Yeah. Yeah.
And I think that's what happens with these 121 students is that they now make that realization in that first year that I can see my 4-year plan.
Yeah.
Because to me now I now see that year 1 is this, year 2 is this, year 3 is this. Year 4, the one we haven't talked about, is the best out of all of it.
Tell us about that.
Because year 4 is our online BSRT program.
Ooh.
So you don't even have to come to campus. You're practicing after year 3, you sit for your boards, you go get hired at the University of Michigan, and you work at the University of Michigan. And now after 6 months, the University of Michigan pays you tuition reimbursement.
Yep.
And you can go to the University of Michigan and a salary. And now you get to go finish your 4th year online doing the degree advancement BSRT program. Where in that case, we go above and beyond the entry to practice. So what is in that program is the advanced adult critical care
ACCS,
specialty,
NPS.
the NPS specialty, the RPFT specialty, the AEC, leadership management. We talk about research. We talk about all of those things, social determinants of health, all the major things that, you know, taking the entry to practice grad and going to the next level.
Yeah. Those are amazing next steps. And I'm sure there's probably a clinical ladder that you have at, you know, the hospital too. So as they're getting there, they've got their RRT, now they're moving into a BSRT or BSRC, whatever the program is, and being qualified to sit for additional credentials, specialty credentials that then boosts their skill set. And
at the University of Michigan, they're a union now.
Okay.
I wasn't part of that first negotiation, but I'm taking notes as the things that we need to negotiate. And that's one of the biggest things, you know, because I get from the other end is, well, I don't want to get a bachelor's degree because I don't get any extra money. Now, data supports otherwise.
It does.
You know, we all know that for every degree you get, you earn 3 to 5% more.
Yes.
However, they don't see that, right? But if we were to say you get $1 extra an hour if you have a bachelor's degree, or you get $2 more if you have a master's degree. But what has taken place without having that true ladder of getting a degree and moving into a higher salary is that in order to advance into either a clinical specialist role or a clinical educator, you have to have a bachelor degree.
Right.
My clinical supervisors, it's a master's. And so those are the levels that we're taking it, right? So without saying it, it's truly there from a departmental standpoint.
There's prerequisites to those positions.
Yeah.
Yeah. And the degree advancement is the prerequisite, one of them, to sit in that role.
Yeah. And I've challenged the department.
Yeah.
When I walked in 9 months ago and I said, so we're adult hospitals, respiratory care, and we do adult hospitals. Can we let's start low. Can I get 50% of my department? Now I have it's a large department.
It's a big department.
160 people.
Yeah. Can
we get half of us to have ACCS?
Right.
Yeah. Can we? And as I've put that out.
That's a challenge. I mean, wow. I mean, you'd probably be the first department in the country.
So that was the take, right? So how amazing would it be to have every therapist, practicing clinicians at the bedside have ACCS?
At ACCS level, like the ACCS is not an easy exam.
that's
Like
right.
you need to be a strong RT. Like you need to know your stuff.
Yeah.
Wow.
So I'm reminded of Simon Sinek. You know, he has
Yeah.
all kind of illustrations. He talks about a bell curve. He says the first 2 to 3% of the bell curve, they're going to do the ACCS on their own. They're self-motivated. They're the ones you don't have to worry about. Your next kind of column in that bell curve is about 12 to 17%.
Correct.
These are your early adopters.
Yep.
These are the ones that are like, well, if Matt does it, I'll do it.
Yeah.
Like if Nick sets something up for me, I'm in. I'll do it. You know. And then there's a next like 12 to 17%. So you have like a 34% target as a director, as a leader that you're trying to motivate to get in on that goal of 50%.
Yeah.
If you can get that 34%, the other ones will follow suit. Because of course there's a bell curve to everything.
Yeah.
That 2% is going to be
It starts to push it a little
it's
bit.
going to
Right?
start to lean that bell curve over, but those are the ones that you want to target for that because you're going to have the 2 to 3% that's going to row the boat the other way.
Correct.
So you're going to have those, right? You don't even talk to them. You don't even talk to them.
Correct.
It's hard not to talk to them. Though.
you talk to them indirectly, like you have that conversation. They may or may not have heard it,
Right.
but in an indirect way, they're seeing it. Because when I challenged the group, I guess I could use the word challenge.
Yeah.
But when I encouraged them to do this, you just saw this increased spike. We went every day. Someone was coming in saying, "Hey, I passed ACCS. Hey, I passed ACCS. Hey,
That's
and
what
then
you want.
our 10 people grew to 15 and then to 20, and we keep seeing it. Now we've kind of plateaued off. So at the most recent town hall for the department, I brought it up again. I said, look, we had this huge influx.
Yeah.
Let's keep the momentum going. Tell me what I can do to help you. What are the tools in that I can provide to you?
Yeah.
Do we need to order a study guide? What do we have to do to help get you there? And so that's where we're at. And I foresee in the future, 50% is kind of that goal.
Mm-hmm.
I think we can get there. And then once we hit that, they know where I'm already trying to get to.
Yeah, you're going to keep raising the bar.
We can get all of us practicing, to do this. I said, because, and truthfully, at the institution, you try to, what profession are we always kind of seen as like in conjunction with? Who do we get
nursing.
Nursing?
Nursing,
You fair? So in order to practice in an ICU in our facility,
Okay.
a nurse has to have a BSN.
Right.
As they should.
Right.
Why would my RT not need
Absolutely.
a BSRT
Absolutely.
or ACCS?
That's where, like, across the country, we're seeing then at that level, we're professionals, right? You have the degree to then be defined as a professional. So if I'm not, seen as a professional, I'm an amateur. This is a hobby to me.
Yeah.
You were a semi-pro hockey player, right? Before you were in rec leagues and it was for fun. But we want to care for patients at a professional level.
Be a professional, absolutely.
And be seen by the care team as professionals. So part of my light bulb moment to get into that was seeing, like, in order for me to fully be embraced, I have to have that degree to go with it.
Yeah. And I get it. The degree doesn't necessarily make you the clinician you are. But it makes you be a better clinician in a sense of
totally agree.
You're getting added things. Like I learn something new every day, and I've been doing this for 25 years now. And you learn something literally new every single day that I go into work.
Mm-hmm.
And outside of work, I'm learning something new every day. And so that's what I see as that added benefit of having that baccalaureate degree on top of the other professions or professionals to say, we're now a profession, right?
Right.
And that's where I think as a whole, we'll probably get to eventually.
Yeah.
I think that's where you see AARC, COARC and alike, MBRC were they're driving that force of saying, hey, look, we want to be seen to be able to reimburse you for your services.
Right.
we need to have that baccalaureate to be entry to profession.
And it's interesting. It's the educational piece. It doesn't really matter what your education's in, right?
Correct.
So, like, I don't have a clinical bachelor's degree. I have a degree in leadership.
Correct.
Did it make me a better respiratory therapist? It did. It made me a more professional. It made me be able to talk and write better and communicate. It helped me solve more complex problems like quality and process improvement.
Yeah.
It made me better
Absolutely.
because I just was a more knowledgeable, more prepared respiratory therapist. And that's what it's all about. God, I wish I had a 1-2-1 when I went to school.
That's what I said.
I spent
I
spent a lot of money in college, especially going back.
Yeah.
Oh my God, that's fantastic though.
Yeah, in the community colleges around in the state, the ones that are missing 5 students out of a cohort, they take 24, but they only have 19. You reach out and say, hey, do you got any 1-2-1ers coming? And I'm like, hey, we can try to send you 2 or 3. I got some coming through the pipeline, but I don't know if they're going to pick your program. They might not pick it, but I can certainly encourage them to select it. But that's the way that we can help fill the seats.
And I love that the community colleges have to love you because you're not competing with them. Like you're supplying. We recently had our friends from Memorial Hermann on, and they do a wonderful residency program. And this is what it's kind of making me feel like you're investing in your people. And when you invest in your people, they stay. What's your retention look like?
In terms of staying at
university?
Mm-hmm. I don't know what my retention number is. I'll be quite honest with you.
But do you worry about staffing every day, or is it, hey, this has got us under control?
So I will tell you this: when I walked into my administrative director role 9 months ago, there were 8 open positions, and we're opening a new. We call it a new hospital. Essentially, we're opening up another 234 beds.
Another hospital,
right?
All right.
So we're expanding, is what we're calling it. So it's a cardio neuro center where we're expanding and doubling our cardiac ICU and our neuro ICU. And I knew going into this that we were going to have to hire for that. Mm-hmm. And we probably have the longest orientation in the country. It's 4 to 6 months of orientation. It's a very robust orientation.
Yeah, so you basically have a residency as well.
It's pretty much like a residency where they do ICU classroom with, Chris, our orientation specialist, does a fantastic job. Puts them through, our ICU classroom. So every day they're talking about the vents and the PES caths and all that stuff that we're doing. We do the nitric and give a shout out to Vero. We use Vero system and, those types of things. So they get this robust week-long orientation as they bridge from going in general care. Because the first part is like the scavenger hunt. Send them to go to find a floor 4A, go get a nursing signature and try to find your way back to the department.
Yeah, I used to do that too.
Oh, that's
They had a scavenger hunt.
At your place, you'd have to.
But to get back to the numbers game, it's so we had 8 open positions when I started. We had to hire another 11 to fill the roles of what we needed for the new pavilion. And to date, I've hired 22 new people.
Yeah.
And so I have 0 openings.
Do you remember what Jessica said? Jessica and Anna from Memorial Hermann. I said, "Do you have any openings?" They're like, "Yeah, we don't worry about openings anymore."
Yeah.
So and that's where it's at, right? And I don't know what changed because the comments were it's always hard to get people to come. They did unionize, so it did help a little bit with the salaries. But it's word of mouth, right?
Yeah.
And then
it is
the leadership,
marketing.
and it's leadership.
Yeah.
And it's the marketing is word of mouth. And people were like, I'm like, why did you want to transfer? Because I got a couple transfers from other, hospitals, and I knew the name. I'd seen them. They'd been in the BSRT program, or I'd seen them in my associate program down the road. And they're like, well, I saw you were the new director, so I wanted to come work here.
Yeah.
And that makes your heart warm.
It does.
It's like, well, I love that. And truly with this new group, we hired this group for a new culture and bringing in a new culture of take ownership and really for my first month or two that I was there inside the hospital, it was just listening.
Yeah.
What are the people telling me that needs to change?
Yeah.
So I started my career at the University of Michigan when I was a student. I was a student tech, got hired in right out of, right as a grad. And when I walked in there, to see what was going on in the department, it was the same paint scheme, the same carpeting, same everything. And I go, wait a second, I think I can sign off to get new paint, new carpet.
Yeah.
And let's change the face of this.
Yeah,
And so that was one of the first big things that I did is I said, rip this carpet out and let's change the colors. And everyone goes, did you pick the color scheme? I said, no. What I did is I talked to the painters and I said, give me my options. And I threw them on the table in a department and let people decide.
Yeah.
And so the department that, the people that were there on that day, they gave the feedback. And so it's a two-tone, wonderful colors, not maize and blue. It's definitely not scarlet and gray.
No.
But it's now like a new face, and I think that goes a long way of wanting to come into work and do the things that you're asked to do.
It's not drab. It's not.
It's not the same.
15 years old. It's
exactly.
It sometimes it takes no effort to do something really amazing. I mean, really change the carpet and the paint. Guys, I did it at one of my hospitals, and they're like, "Oh my God, Matt, I can't believe you got this done." I'm like, "I just asked the painter."
Yeah,
do anything magical.
Yes,
you didn't have a paintbrush.
No, I was a painter.
No, just put in the ticket.
Yeah,
and get it done, and just listen. Right, listen to the people of the things that needed to be done to try to implement change. And retention was always discussed, like how are we retaining people? And to me, it's listening to what needs to be done and to hear what they need to achieve for their goals. What do my RTs need? Like, what's next? I sit down with RTs throughout the course of their shift, and I always ask them, what is next?
Yeah.
What is next? And they're like, what do you mean, what's next? I'm like, are you thinking about 3 years from now? Are you thinking about 5 years from now? Because I want them to start thinking about that.
Absolutely.
We do that with our students. Why aren't we doing it with the clinicians?
I mean, Matthew McConaughey has a famous speech. I think he was winning some award. And he talked about, they were asking him about, who his role model is. And his role model is himself 5 years from now. What do I need to do to become that person that I see myself as 5 years from now? And yeah, you got to be asking that question all the time. What's next?
And he also followed that up to say he'll never be that person.
Exactly.
But he always has a way to fight to it.
Striving for tomorrow, but tomorrow never comes.
The way I see my job and my role as it's kind of grown here is to make those people see that vision and then help push them toward it.
Right.
And not sometimes push them in the back, truthfully.
Right.
But it's to put the platform underneath their feet to start making them take those steps.
That's exactly right.
That's what
you're paving the road for them.
Correct.
Absolutely. Right. That's the way to go.
Taking all the potholes out, all of the things.
All of it.
Absolutely.
Yeah.
So I'm mad that I didn't go to school in Michigan. I'm mad that I'm way too old to go to school in Michigan. But this is impressive.
Yeah.
I think the big key takeaway, JJ, is when you invest in your people, you don't have a staffing problem.
Yeah.
Just saying.
We've seen it twice already in 60 days.
60 days.
We've seen two programs that are investing in their people and they don't have a staffing issue.
Yeah.
So I think that's what it is. When we're talking about leadership, we're talking about, all the therapists that are out there, barflies worldwide. They're like, hey, I want to work in a place that I feel valued. Investing in those people matters. And we're in the people business. That's what we're in.
That's it.
Yeah.
So we're not in the event business. We're not in the doing that business. We're definitely not doing that business, but really investing in your people. Perfect example. Nick, very, very impressed. As always, here on RT Sidebar, we give shout outs at the end.
Yeah.
Okay.
So I'm going to go to JJ first. That'll give you a few seconds to think about your shout out. So JJ, Who you shouting out today?
Jeez. Of course, gotta shout out the wife. Her birthday was on Monday. That's always the layup, right? That is the layup.
Yeah.
Alicia, I hope you are enjoying the roller coasters. I'm glad your brother went with you because that's not my thing. We'll go to SeaWorld and we'll have a blast. But my shout out goes to all of the therapists that are here at AARC, that are here at Summer Forum, that are developing relationships and collaborating. There
I
are
like
so many hallway conversations that take place that are, you know, that are building what could be for the future.
100%.
I like it. And there were a lot of first timers.
Yes.
That's always the impressive thing to see. You know, when you come in the first day.
A lot of first
Timers.
timers.
Pia, she gave her very
Pia.
first presentation
Yeah.
this morning,
Pia.
and she said she was about to cry, but she did such an amazing job.
That's awesome.
You could not tell it was her first time.
Never.
Congratulations, shout out, Pia.
Yes, there you go.
Shout out, my friend.
I'll give a shout out to my wife and my family who made the trip with me.
Oh, nice.
So
Very nice.
that's nice. I'm here for the week. So my wife's an RT. She's an educator. So give a shout out to her and her students down there at Monroe County Community College.
County. Nice.
So they're doing great things over there. And then I'd like to give a special shout out to all of the respiratory therapists, the clinical specialists, my clinical supervisors, my respiratory technicians running the ABG labs and EKGs at the University of Michigan, who work literally tirelessly, taking your call shifts, doing all of those things to run the operations, to take care of our patients, and really, truly be a community-driven department. And it's to just hear the things and see it in action. I'm just blessed to be a part of it. Our team is doing amazing things. University, all the students that are taking the initiative to get the BSRT and go above and beyond. I tell them all the time in my announcements how thankful I am for them to do this, to go above and beyond, because I truly feel like that's where they need to go. So shout out to all the students too, that are taking the time and bettering themselves. And thank you, and go Blue.
Well, I don't think I can follow that up. So we're gonna end. I do want to give a shout out, very quick shout out to ARC's new VP of Education, Dr. Kelly Caldwell.
Yes.
And, he's
Yes.
also
Kelly.
my wife's teacher.
Okay.
So it's he invested in a lot of people too. So shout out to you, Dr. Caldwell. Nick, fantastic.
Yeah.
Fantastic episode. JJ, as always,
Yeah.
my friend.
Mindy, we missed you. We knew we had to sneak this one in without you being here.
Yeah.
Being Nick, but we definitely missed you today.
So from all of us at RT Sidebar and all the bar flags worldwide, thank you, Nick. JJ, as always.
Absolutely.
Be at Summer Forum next year, and stay tuned.
Stay tuned.
David Thurman does not practice medicine or provide medical services or advice. Any clinical recommendations provided herein are solely those of the speaker. Practitioners should refer to the full indications for use and operating instructions of any products referenced before use. Hosts and producers are paid employees or consultants of David Thurman, and our guests are not compensated.